Today we have Dr. Wayne D Reuter presenting Feeling Stressed, Don't Light Up. If you're interested in obtaining a letter of completion for this Teach educational round, please make sure you have registered for the webinar and completed the pre-learning assessment, signed in with your first and last name, and complete the evaluation and post-learning assessment after the webinar, which you will receive a link for by the end of tomorrow. You will have 1 week to complete the evaluation and post-learning assessment. Please note that a copy of today's presentation slides will be sent along with a recording of this webinar by the end of day tomorrow. This webinar is also being live tweeted on Twitter. You can follow us at PSQuitSmoking and use the hashtag TeachWebinar to post or read questions. Our presenter today is Dr. Wayne D Reuter. Wayne graduated from the University of Toronto with a PhD in exercise sciences. Currently, Wayne is a research analyst for the STOP study at the Nicotine Dependence Service at the Center for Addiction and Mental Health. The STOP program is a real-world research program that determines impactful ways to assist smokers in Ontario and to quit tobacco use. The presenter would like to share the following disclosures. Please note that the contents of the Teach educational rounds are centered on evidence-based guidelines from the following sources. These materials, as well as the verbal presentation and any discussions during the webinar, are only general principles and they do not replace the need for clinical assessments or treatment plans by healthcare professionals. For those that have just joined us, please note that we have a chat feature that you can use to post any questions or to add any comments throughout the webinar. To use the chat feature, you can click on the speech bubble icon at the bottom of your screen to open up the chat room on the right-hand side. Please make sure that when you are posting your questions or comments that you are sending it to all participants to ensure all attendees and panelists will be able to view your questions. And with that, I will hand it over to our presenter.
Thank you very much, Victoria. Can everybody hear me? Are we good to go? Okay. So unfortunately, the webcam that I'm using today is not cooperating. So you won't be able to see me today. Just wanted to let you know that. I'm not trying to be rude or anything like that, but the webcam is not working. So today we're going to look at stress and smoking cessation, and we're going to cover 3 main topics here. First, we're going to look at describing stress and explain how stress influences smoking cessation. Next, we're going to look at ways to assess stress. And finally, we're going to work together and hopefully integrate some self-care, prevention, and treatment techniques into our practice. So I thought we would start off and get some audience participation here right off the bat. When you hear the word stress, what do you think of? Is there a certain term that comes to mind or terms? Is there a phrase? What do you think of when you hear the word stress? Okay, so overwhelmed, anxiety, elevated cortisol, that's good, yeah. Something's not good, okay, good. Anxiety, yuck. So some physiological responses here, good. Something is unpleasant here. Okay, negative feelings, I think that pretty much sums up the way everybody feels. Stress is a normal part of life. Okay, that's good. That's good. All right, anybody else? Relax the brain, yeah. Okay, so I want you to just hold off on these descriptive words. Stress is good, or good stress. Okay, we're gonna get it. You're getting a little bit ahead of me here. I want you to just hold on to this these terms that you wrote there just for a few seconds here. And we'll come back to them. So there we go. So there's really no standard definition for stress. But one definition that is commonly used is that stress occurs when pressure is greater than the resources that we have at our disposal. So in other words, an event happens, a situation happens, and there's quite a bit of demand, substantial demand placed on us. We feel a great amount of pressure. And it's this pressure is greater than the resources that we can mobilize, whether those resources are energy, time, knowledge, or abilities, right? So we just feel this crushing amount of stress because we don't think we can handle the task at hand with the resources that we have. Now, let's go here. Now, somebody mentioned good stress or something like that. And we're going to talk about that right now a little bit. But for the most part, many of you talked about stress in a negative way. And that's okay. I mean, most people, when they hear the word stress, they think of negativity. But this is a picture of the human performance curve. And what we see here is performance on the y-axis, stress on the x-axis. And if we look to the left here, when we're calm, all right, our performance in a specific activity may be hindered somewhat because we feel bored, maybe it's not stimulating enough for us or doesn't get our full attention. If we move to the right, okay, we see distress. Right? So this amount of stress we're feeling is just starting to become overwhelming. It's piling on and piling on. And that's when we start to feel fatigued, exhausted. We may experience ill health. And if it lasts long enough, we may experience breakdown or burnout. So like a lot of things in life, stress is about maintaining a specific balance, all right? You don't want too little stress and you don't want too much stress. And it's when we can maintain that specific balance that we have optimal performance. We feel energized. We're focused at the task at hand. We're effective in whatever we're doing, okay? The work feels effortless. So we want to try to maintain that balance. So stress is not necessarily a negative thing, or it shouldn't be described negative. It can also be positive as well. So how big a problem is stress? Well, in Canada, 21% of Canadians feel either quite a bit stressed or extremely stressed most days of the week. So that's at least 4 days of the week that they're feeling quite a bit stressed or extremely stressed. 1 in 5 people. Stress is more prevalent among females than it is for males. And it's more prevalent among those between the ages of 35 and 49, where almost 1/3 of Canadians feel quite a bit stressed or extremely stressed. Now, signs of stress can vary from one person to the next. What I have when I'm stressed may not necessarily be a sign of what you have when you're stressed. But some of the more commonly used or common signs of stress include headache, pain, tiredness, racing heart, grinding teeth, and sleeping problems. And again, sources of stress can vary from one individual to the next, but some of the more common ones are financial problems, daily routine, so the hassles that you have every day, work is a very large stressor for most people, personal relationships, your health, and death. And of course, I would be remiss if I did not talk about what we're currently experiencing now, which is the COVID-19 pandemic. So let's take a moment and look at how stress levels have been affected by the COVID-19. Now, this was a poll taken by the Mental Health Commission of Canada. And the very top bar here, we see that the month before the pandemic or the outbreak had occurred, 50% of people were occasionally stressed. 17% were regularly stressed. And 4% of people were stressed all the time. And then in the last month, so that would have been sometime in early April or late March, because of the COVID-19 outbreak, we see stress levels change dramatically. So we went from 50% to 38% of people being stressed occasionally. And the percentage of people who were stressed regularly doubled, almost from 17 to 33%. And those who were stressed all the time tripled from 4% to 13%. What are people stressed out about during the COVID? Well, 26% of people are worried about contracting the virus themselves or a family member contracting it. If I can just give a real quick personal story here. I was supposed to do this presentation, this webinar last month, and a couple days before, I was presenting symptoms of COVID and I needed to get tested. And right away, my mind just jumps to negativity and it just I start freaking out and getting all stressed out because I'm thinking, okay, now I have COVID and I have a medical condition, I have asthma, so I'm at high risk. And who have I been in contact with the last 5 or 7 days, whatever it is, and I have kids, and how am I going to quarantine from the kids because they want to see their father all the time? So it can be very, very stressful. And of course, you're waiting 4 or 5 days before you get these test results too, right? And your mind just keeps going through this stress and all these different scenarios that can lead to negativity. So luckily I didn't have it. I tested negative, so that was good. But again, it was very stressful 4 or 5 days. People are also worried about finances and job security, 19% of them. And other stressors can include uncertainty, the fear of the unknown, which is always very stressful. Feeling trapped, work-related stress, stress following the guidelines that are imposed by us. So now we have to wear masks, we have to stay 6 feet away from everybody, and also loneliness as well. So that is a quick overview of stress and sources of stress and signs of stress. And I don't think that is too much of a surprise for anybody. But I want to switch gears now a little bit and talk about how is stress related to smoking. And again, I'm going to ask for some audience participation in doing this. What do we know about how is stress related to smoking? Okay, so it provides temporary relief. Yep, it's a coping strategy for many people, helps them to reduce stress. Calming, yep. Smoking, yep. Nicotine causes, so a lot of you are saying nicotine causes stress. That's correct. Smoking helps people relax, okay. Mentally calming, helps you relax. Yep. Okay, so many of you touched on what I want to talk about in the next couple minutes here. All right, so what we know is that stress is related to a greater odds of smoking. So as your stress levels increase, you're more likely to smoke. And not only are you more likely to smoke, you're more likely to be a heavier smoker. So you're more likely to smoke 30 or more cigarettes a day. It's also associated with nicotine withdrawal symptoms as well. So greater nicotine withdrawal symptoms. It's an important barrier to cessation, particularly among vulnerable groups, those with mental illness or low SES. And a couple of you mentioned that it is a coping strategy for dealing with stress, and you're absolutely right, it is. I want you to think about this for a second, though. So let's say a smoker comes to your clinic and they have to quit smoking for whatever reason. Maybe they have an upcoming surgery, or maybe health problems, whatever it is. They need to quit smoking. And for many of these smokers, smoking may be one of the few options or the only option that they have to manage stress. So they're already in a stressful situation trying to quit smoking. And now we're making it that much more difficult because we're telling them you can't use your coping strategy anymore, the strategy that you use to deal with stress. So it would be similar to me telling you you can't exercise or you cannot listen to music, you can't talk to your friends when you are stressed. You have to figure out another way to deal with stress. So smoking, if you talk to smokers, they'll say that smoking gives an impression of feeling calm, relaxed, and it regulates their mood. They just feel great. But that's actually an illusion, and I saw in the chat that some of you kind of mentioned that. It's not necessarily true. And smoking can increase stress levels in two ways. One, smoking can put a tremendous stress on the body because when you smoke, you have an increase in blood pressure, heart rate, your muscles tense up, blood vessels may constrict, and you have a decrease in oxygen throughout the body. So that's one way. And smokers often require nicotine to regulate their mood. So when you smoke, nicotine activates the neurotransmitters in your brain and dopamine is released. And it's this dopamine that is released that allows smokers to have these great feelings. They feel calm, they feel relaxed, they feel great. But after a while, the dopamine levels start to decline. And this is due to nicotine deprivation. And these positive feelings vanish as well. And now smokers start to feel stress. They feel tense. They feel irritable. Okay? So it's kind of like a vicious cycle where smokers feel good, but after a while they start to feel stressed. So they have to smoke again in order to get the nicotine into their body so they feel good again. And it just is one big cycle. And smokers just have to have that nicotine in order to feel good. And that's why when you talk to smokers after a stressful event, they'll say that the first cigarette is the most satisfying cigarette. And oftentimes, those heavier smokers, the ones that are just chain smokers and they keep smoking and smoking and smoking, they tend to have less stress than those smokers who don't smoke as much. But the research has shown that smoking cessation is associated with a reduction in stress compared to continuing smokers, and that stress scores are significantly lower in abstinent smokers compared to relapsed smokers. Okay, so I want to spend a great deal of today's webinar on talking about integrating self-care and prevention and treatment techniques into clinical practice. Now, just a quick disclaimer here. I am not a clinician. I have no clinical experience whatsoever. But I'm hoping that today's webinar, we would be able to maybe bounce some ideas off of one another and see if certain things can work and certain strategies cannot work as well. So I thought we'd start with a case study here. Now, I want you to meet Julia, and Julia is a 35-year-old female, recently diagnosed with early signs of COPD, which has prompted her to seek help. Upon assessment, you learn the following: that she currently lives on her own, working as a full-time administrative assistant. She is seeking secondary part-time employment to help pay the bills. Cigarettes are her primary source of stress relief. So again, that's her only coping strategy. She struggles with motivation, feelings of worthlessness, difficulty concentrating, and sleeping. Currently, she experiences symptoms of severe stress and anxiety. Family history of stress disorder, and describes a history of trauma as a child. She's been smoking since the age of 14 and currently smokes 40 cigarettes a day. She consumes alcohol, but only socially, and she has a family history of alcohol use disorder. She is 20 pounds overweight, and has a high blood pressure controlled by medication, and chronic back pain managed by Tylenol 3. So my first question to you is, where would you begin? Julia comes to your clinic and she gives you this history about herself. Where do we start in terms of stress levels? Okay, so you ask her, right? Okay, so what causes her stress? Okay. Coping strategies, okay. Okay. So I'm seeing a lot of, excuse me, I'm seeing a lot of asking the client what they want to work on, okay, whether they want to quit or reduce, if they have any hobbies, okay. Try to come up with some coping strategies, okay. Has the stress impacted her life? That's a good one. So one person, Matthew, I normally like my clients to begin by describing their average day and what points them they feel most stressed. Now, my question then for other people who said talk about their stress, what if they don't know what stress is about? How do you handle that then? How they cope with their day, okay? Okay. Well, one place I thought, and there is no diary chart when they smoke. Okay, yeah. Ask them to think back on what was on their mind. Okay, and how do you feel before and after they smoke? That's great. Okay, so there's no right or wrong answer, and one way that I thought we could start this is by assessing the stress levels of Julia. Now, does anybody do that? Do they, when a patient comes in and they're feeling stressed and they want to quit smoking, does anybody get clients to fill out a stress questionnaire or anything like that? Okay. So you do not, but you'd like to learn? Okay, that sounds good. No, but it sounds like a great idea. Okay. So maybe I do have some potential as a clinician. This is great. All right, so I'm seeing that a lot of people, or not a lot, but a few people do not get clients to fill out a stress questionnaire. So let's go over it very, very quickly. Oh, so okay, so one comment was I query about anxiety and depression, but not stress. Okay. Might be similar with added stress questions. Okay, so let's go over this assessing stress really quickly here. So this is the perceived stress scale, right, or PSS. And it is probably the most common stress scale that is available. And it consists of 10 questions, right? And each question is scored between 0 and 4, with 0 being negative or never, and 4 representing very often. So on the side here, on the left-hand side, you'll see stars beside questions 4, 5, 7, and 8. And that just represents that those questions need to be reverse scored. And the perceived stress score like I said, it's 10 questions. It doesn't take very long to do, maybe 5-10 minutes. And it deals with questions like, do you get upset when something unexpected happens or something out of your control happens? How do you deal with stress? Do you get angry? Are you able to control anger or irritations that you may be feeling when you're stressed? All right. So I thought that we could maybe start here with Julia and just try to determine just how stressed she really is. So on the right-hand side here, you'll see a score that represents how Julia would have answered this scale. And we see 3, 3, 4, 1, 2, 4, and 1. So this question, what do the stars mean? So the stars mean that those questions need to be reverse scored. So questions 4, 5, 7, and 8 will need to be reverse scored, and I'll get to that in a minute. But Julia's scores are 3, 3, 4, 1, 2, 4, 1. Now, just looking at the first 7 questions, what observations can you make from this? Does anything come to mind? Does anything pop into your head? Any conclusions that we can make based on how Julia answered this questionnaire? Numerous high numbers, okay, yeah. She may feel like she's lost control, yeah. A lot of stress and is not coping with very well. Yep. Receiving a lot of stress. And few personal resources. That sounds like that's really good. Sounds good. Great observation. Okay, anybody else? Control or lack of control seems to be an indicator of stress. Yeah. Okay. So let's move on then to where are we here? Let's move on to the final 3 questions here. So I mentioned again that 8 was a reverse score, and that's why you see the star beside question 8. But Julia scores a 2 and a 3 and a 4 on the final 3 questions. Now, looking at these final 3 questions, or bringing together the whole picture, all 10 questions, any other comments or observations that we can see here? Assess her perception of things, yeah. She might be surprised at how stressed she is. That's an excellent point. I think most people do not really realize how stressed they are until they take on a scale like this, how they complete a survey. Get the chance to review what she is in control of and what she isn't. Yes. She feels overwhelmed. Yep. Certain stressors may be adding each day and unsure of how to manage the daily routine. Excellent. Very good. And confidence, yes. She has probably low confidence. It's probably lacking right now. Okay, so let's move on. So as I mentioned, the perceived stress scale, 10 questions. You're going to reverse score questions 4, 5, 7, and 8. All right. So if they put a 0 down for those questions, it actually would be a 4, a 1 would equal 3, 2, 2, so on and so forth. And then what you would do is you would sum up the score for each question. And the higher the score suggests higher perceived stress. Now, does that sound feasible to use in your clinic? I saw that a number of people thought it'd be a good idea to assess stress, but does that seem feasible in your clinic, or is there some reason you can't? Very good. A lot of people are saying yes, yes. Okay. So like I said, I mean, it only takes 5 to 10 minutes to do. It is one of the most common ways to assess stress as well. Okay. Time is tight but doable. Yes, time is always a factor. Absolutely. Yes. Okay. Is this a copyrighted tool? Not that I'm aware of. You can easily find it on the internet if you just do a search. So I'm not aware that it is a copyrighted tool. Yeah. And they could do it in the waiting area. That is great too. PHQ-9, yeah. I think the PHQ-9, is that more depression then, or is that stress? Depression, okay. That's what I thought, yeah. Okay. All right. Oh, and somebody gave us the link right there. Thank you, Carolyn. Okay, so let us move on here. So Julia's stress level is at 31. That is her score on her perceived stress scale, indicating high perceived stress. And I think anything over 27 on the scale is considered high perceived stress. Now, Julia wants to quit smoking, but she feels her stress levels will hinder her quit attempt. Julia recognizes that she smokes when she is stressed, but can't provide any information as to when and why she smokes. So she's offered some supplies in the form of NRT patches. All right. What other resources could you offer Julia to help her manage her stress? So this came up in the discussion a little bit. Some of you mentioned that you would want to know when or why she smokes and when she is stressed. So what could we do to determine that? Journaling, yeah, that's great. Building awareness through tracking, good. Okay, so a smoking log, listen to our doc, journaling, yep, great, fantastic. Quit smoking apps, oh, that's a great idea, yes. Getting technology involved. Calm apps, yep. All right, so one thing that we use here at the Nicotine Dependence Clinic at Camh is a tracking card. Now, the nice thing about this tracking card is that it not only has the number of cigarettes that you're smoking each day, but it also has the time, the place, and your mood. You can log how you were feeling during that time. So whether you were feeling happy or okay, or sad or stressed, depressed. And it also has a rating on it there which indicates just how badly you needed that cigarette. So was it a 5 where you must have it? You absolutely could not do without that cigarette. Or was it a 1 where I had a cigarette, but I probably could have done without it? And so that's a card that we use here to help people recognize how how they're feeling when they start smoking. I see a comment here, can we get a PDF of this tool? Sorry, were you referring to the tracking card or the PSS? If you could just let me know. Oh, the tracking card. Yeah, I can see if we can send it out with the slides. That would be great. Yeah. Let's see here. So Julia comes back to the clinic and she states that now she has reduced her tobacco use from 10 cigarettes a day to, from 40 cigarettes a day, to 10 cigarettes a day. And she presents her tracking card. So let's take a look at her tracking card. And now, what can we determine from this tracking card? So we see that she's smoking 10 cigarettes a day at various times, various places. So when she wakes up, she commutes, she goes to work, commutes again, and at home. So a pretty routine day. You can see her mood there, how she was feeling when she was having these cigarettes, and just how necessary that cigarette was. All right. So what can we conclude? Is there any observations or anything that stands out looking at Julia's tracking card? The morning is nicotine withdrawal. Yep. First cigarette of the day. Yep. She's able to deal with her stress. Yep. Must have. Yep. She's sad when she smokes. Okay. Yep. For the most part, for half the time. Yep. The commute is very stressful. Yes. Absolutely. I think it is for most of us. Yeah. So what could we suggest then if her commute is stressful? I see one person has already said that maybe an opportunity for pleasurable activity. Yeah. What else could we suggest then if her mood is, or if her commute is stressful? Double up on morning and evening leave. All right. Cigarette to last and take away. Okay. Being around other smokers, maybe. Absolutely. I think that's kind of what I was getting at when I came up with this. So the work break too, right? So Julia could practice some mindfulness or some of the activities that she prefers as well. So music, sunflower seeds, good, cinnamon hearts, yep. Great. Podcasts, yes, absolutely. Getting back to, I don't know who wrote it here, but somebody was saying that something about work breaks are, maybe she's around other smokers, and that's an excellent point, yes, because you see that she's rating a 2 during lunch and her work breaks, right? For the most part, until the afternoon, and that might be when things start getting a little bit stressed out and a little bit hectic. She could change the form of her commute. That could be an option as well, perhaps. Yep, absolutely. Okay, so moving on. Actually, before I move on, does this sound reasonable? Is this something that you guys would consider implementing? For those that don't, I know some of you said that you do implement journaling, but is this something that is feasible? Yeah, okay, good. Looks like my quit log. Okay, good, good. So some of you already implement this already. Actually, that's a great question, a great point somebody brought up there, Caroline. Do you find that patients actually use, for those that use this tracking card, do you find that they actually use it? Yeah, I find that they don't fill it out. Okay, depends on the person. Yes. Okay. Some don't. All right. The ones that are more successful. Okay, great. Okay. Okay, so that's good. That's good. Oh, literacy and other issues can impact. Absolutely. Yep. Yep. After knowing the PSS scale, would this be a tool to narrow down where from? You could definitely use that. So the PSS scale would be an option to just see how stressful people are, and then you could definitely use this to narrow down when they are stressed out. Absolutely. I ask clients to do it on work and non-work days. Oh, excellent point. So that's a great point. Because your stress levels can definitely change between work and non-work days. Yes. Okay. All right. So moving on. What additional information would you like to know or discuss with Julia regarding her stress levels? Is there anything else you would want to talk to her about? Any information that you would counsel her on or want to know about? So how she manages stress now. Okay. Good. Has she tried anything before and what she likes? Her strengths and supports. That's a great point. Knowing what her strengths and supports are, absolutely. If people are there for her and they can help her out to help quit smoking and manage her stress. Yeah. Okay. The value of therapy. Yeah. And what activities she enjoys. That's a great point. Yeah. So again, we talked about this second, differences in stress levels between work days and weekends? Yep. And has she seen a doctor and her physical health? Absolutely. Triggers? Yes. Okay. Now, how would you, if you look back at the case study here, she talked about how she would drink alcohol, but only socially. Is that something that you would be concerned about? Because alcohol does contribute to stress, but at the same time, if it is socially, would that be something that would concern you? Absolutely. Yes, yes. What does social look like? Yes. What does social drinking look like? Yes. Okay, so transfer to addictions. Yes. So if it does concern you, okay, so that was going to be my next question, but Shelley kind of addressed it. Ask some screening questions about alcohol use. Yes, I would probe to also see if that is a trigger. Absolutely, yes. Okay, good. And how about these feelings of worthlessness and lack of motivation? How could you address that? Because if the stress gets to be too much and she goes back to smoking, is that going to contribute to that lack of motivation and worthlessness? Is there any way we can address that? Needs a depression screener? Sure, absolutely. Yeah, that would work. And look at what is good in her life. That's a great point. I mean, we only described the bad things in her life with her history, but we didn't describe the good things too. So maybe ask her about that. Normalize the difficulties for a period of time. Yep. And maybe discuss her goals. Good, good, good. Just one other, well, actually not one other question. I have more, but how about her finances? That seems to be a source of stress where she's working a full-time job and then trying to get another job as well, part-time, to manage her stress. How could we deal with that, knowing that finances is often a very large stressor for quite a few people? Any ideas how we could talk to her about finances? What we could do about that, make suggestions. Explore how reducing quitting would elevate some of those financial stress. Yep. Explore debt. Yep. Reducing cigarettes, credit counseling. Absolutely. Okay. I mean, if she's going from 40 cigarettes to 10 or even 0 cigarettes, that would reduce or give her more income. That's a great question, or that's a great comment. Yep. Quitting and saving money from cigarettes can reduce financial stress. Yep, absolutely. Okay, and educate on the differences between needs and wants to manage financing. Great. Okay, good. Okay. Where am I here? So let's look at stress management strategies for a second here. Oh, Brian brings up a good point. What do you need the money for? Does work meet your needs, or do you enjoy your job? And is it who you are? That's a great point. That's a great point. And then there are apps that can tell you how to save money. So again, technology. It's great. So let's look at some stress management or coping strategies. What do you think would be a good strategy to deal with stress management for Julia? What would you suggest? CBT, yeah. Okay. Deep breathing exercises, yeah. Free activities in the community. So start with what she has tried and what has worked in the past. Yep. Walking neighborhoods, positive supports, absolutely. Yeah. Okay, so goal setting and activities that she enjoys. Good. Okay. Anxiety Canada. I'm not familiar with that. Is that organization or something? Counsel her on, speak with somebody about counseling her on issues. Yep. Okay. Okay, so let's talk about stress management strategies for a moment. So in order to come up with coping strategies for stress, first you have to recognize that you are stressed. And we talked about the warning signs of stress before, so that could be headache, and it could be pain, tiredness, sleeping problems. And then, like I mentioned before, with the perceived stress scale, you may not realize just how stressed you are until you actually fill out one of those questionnaires or surveys. So the first thing we have to do is recognize that we are stressed. And then once that happens, we can suggest some coping strategies. So some of you mentioned relaxation, so maybe meditation, deep breathing exercises, yoga are all great ways to deal with stress. Exercise is another great way. Aerobic exercise would be better than anaerobic, but I realize that not everybody can do running or cycling or anything like that, but just walking can just melt the stress away. Healthy diets. So we want to concentrate on fruits and vegetables, foods that are high in fiber, comfort foods, all right, and stay away from alcohol and caffeine. Please don't shoot the messenger, but that just shows that that can increase stress, is alcohol and caffeine. We want to get adequate sleep as well. So we're looking at, and this can be hard, 7 to 9 hours of sleep a day. I don't know anybody who can get 9 hours of sleep a day, but you want to try to get as much sleep as you possibly can. Think positive thoughts. They can really help to just kind of take your mind off the stress as well. And finally, don't take on more than you can chew. Don't get overwhelmed with responsibilities and take everything on. I know that can be very, very difficult when at work, when your boss wants you to do X, Y, and Z, but just know your limits and don't take on too much work. And of course, somebody mentioned CBT, and CBT in combination with stress control programs has been shown to help people quit smoking. All right, so in conjunction with stress control programs, it helps people quit smoking. That's a great point. Recognize what you can change and what you can't change. That's really good. Yeah. And learn to say no. Very, very good skill to have is to learn how to say no. It's easier said than done, but yeah, definitely a good skill to have. Okay. So the World Health Organization, they put together some coping with stress strategies during the COVID-19 pandemic, and I just wanted to touch on these a little bit. We've already discussed some of them already, but might be worth going through. And you can find this on the internet. It's not hard to find, and this may be something you want to share with your clients or family. So first off, just recognize that it's normal to feel sad and depressed during these times. These are very challenging and difficult times. So it's just natural to feel stressed out. And talking to people that you love and that you can trust can definitely help with this. Okay. Oh, somebody's asking me for the link. I can provide the link for you on this. Absolutely. Yeah. When we send out the slides. So we have to stay at home. although that has laxed a little bit recently. But while you're staying at home, you want to maintain a healthy lifestyle. So whether that's be adequate diet, proper sleep, or exercise, and just being in contact with other people. So just give you an example, right now, CAMH, we're working from home at the Nicotine Dependence Clinic, but we have staff meetings every other day just to be in contact with one another. And it's great to see other people's like their pictures or hear their voice once in a while. So that's great. Just be in contact with people that you know or you love. I already mentioned this. Don't use alcohol or drugs and try to quit smoking, which is easier said than done. Get the facts. You need to get reliable information that is you can trust and that is helpful. And that way you can determine what your risk is and any precautions and any do's or don'ts that you should be doing during the COVID-19. And I'm going to make a plug here. I'm a little biased here, but I'm going to promote here the CAMH discussion forum that we have. There's the link right there. And this is a peer-to-peer discussion forum which offers support and encouragement to share your experiences, manage stress and anxiety during these difficult times. Now, the great thing about this discussion forum is that it is monitored by staff at the Nicotine Dependence Clinic. So who better to talk to about stress and anxiety while quitting smoking than people who work at the Nicotine Dependence Clinic? So this is something that you can share with whoever, your clients, your staff, whomever. It is a really great resource, and you can just post questions or comments, whatever, and they're answered fairly quickly. But I thought that would just be great that if you're trying to quit smoking and trying to reduce your stress, this would be a great forum for that. CAMH also has resources that deal with COVID as well, and these resources would include dealing with grief, stress, anxiety, and kind of do's and don'ts during this COVID-19 period. So just to continue here with coping strategies, you want to limit perhaps the amount of media exposure that you're getting. A lot of times during difficult situations, you'll see the media and it's a negative message after negative message, and that can be very stressful, okay, and depressing. So you might want to limit your exposure to the media as well, right? And finally, we've all been in situations where we have felt stress before, and we've gotten through those using specific skills, whatever they may be, during adversity. So it might be worth trying to tap into those skills again during this period of time. So whether it's exercising or humor, listening to music, whatever, those skills that you've used in the past could work now. All right, so just to summarize, sorry, I was going to the chat for a second. Just to summarize, stress affects everybody and they come from various sources, all right? Stress is associated with tobacco use and nicotine withdrawal symptoms and heavier smoking. And I think we talked about today how we can incorporate stress management strategies into our clinical practice, whether it's the tracking card that we discussed or the perceived stress scale. And then we can also counsel people on strategies that they can use as well, whether it's exercise or healthy diet, whatever. So I've seen a number of comments about the perceived stress scale. We can make that, we can send a link with the presentation for you, and also the tracking card as well. I don't think that would be a problem. So we'll send those with the presentation. And I think that's it. If anybody has questions. I can try to answer them the best that I can. Oh, thank you, Victoria.
There's just a couple of questions. We have time for one or two pertaining to the perceived stress scale. One was, would this be appropriate for youth? And then another question was, is it an evidence-based tool?
It is indeed an evidence-based tool. Yes, it is. Whether it would be appropriate for youth, that's a great question. I can look into that for you. I think it has been used in previous research as among youth. So I think that it is appropriate for youth.
Okay, thank you. Thank you, Wayne, so much for sharing how to assess and manage stress in the context of smoking cessation. Today's webinar was definitely one of the most interactive ones yet. For the participants, just to let you know that this webinar has been recorded and will be distributed with a copy of the slides and any other resources we've shared. And a reminder that the link to the evaluation and post-learning assessment will be sent by email by the end of tomorrow, and you will have 1 week to complete it for a letter of completion. If you participated as a group to this webinar today, please email teach@camh.ca with a list of the names who attended together by 3 p.m. Eastern Time today. The next webinar, titled Understanding the Link Between Smoking and Diabetes, will be presented by Dr. Osmat Melamed and will take place next Wednesday, July 15th, 2020 from 12 to 1 p.m. If you missed a portion of today's webinar, or you are interested in viewing it again, or you want to view our previous webinars, an archive list can be found on our website. Thank you, everyone that joined us, and have a great rest of the week. Thank you, Wayne.